In today's episode, we are going over physical therapy treatment for wrist pain during Olympic lifts, barbell lifts, handstands, and push-ups. First and foremost, thank you so much for your support. You truly allow me to do what I love for a living. My name is Dan Pope. I'm a physical therapist. I'm a coach. I'm a personal trainer. I'm a meathead. I love lifting weights. I love everything fitness. This is a fitness pain-free show where we help coaches and physical therapists like you get your patients and clients out of pain and back to training where they belong. If you're watching this on YouTube, please hit that like button, comment, and subscribe to the channel. Helps me out greatly. If you're listening to the podcast version of this, please give me a positive rating and review. Helps a ton. If you want to support the channel further, consider subscribing to Insiders. It's a comprehensive educational resource and toolkit for the fitness and rehab professional. Think Netflix, but for trainers and physical therapists. It is premium content from yours truly, right? Similar content to the Fitness Pain Free Show, but more in depth. It's updated monthly. I've been updating it for the past 5 years. It's absolutely enormous at this point. You've got over 100 plus webinars, ebooks, and complete guides. You have access to a private Facebook group to have all your questions answered by me. You can decide upcoming podcast topics, and you get started for just $1, extremely cheap, right? Can't even buy coffee for that cheap, and you can cancel anytime. So if you're interested, you want to check it out, go to fitnesspainfree.com, go to the program section, Fitness Pain Free Insiders online library, and you can get started right away. I'll also leave a link in the show notes for you guys to make it easy. So why are we talking about wrist pain today? Well, first and foremost, this was actually recommended from one of you guys for me to cover, so I appreciate it. Thank you for giving me these topics. I love doing it. I love to see that people are engaged and they want to see more from me, so that's great. And if you want to decide future podcast episodes, please let me know, right? But first and foremost, this was requested by you guys, right? And the other piece is that it's actually a very common complaint. So if you start looking at injury research, you don't see a ton of research on wrist or hand pain. It's just not as common as let's say the shoulder, the low back, the knees. But I got to tell you, as a former CrossFit coach, CrossFit athlete, and also someone who really likes gymnastics, so handstand balancing, all those handstand walking, handstand pushups, there are quite a few wrist injuries, right? It's actually quite a common thing. So I looked through some of the medical literature to see if we can find some more statistics for this type of pain. And I was surprised. So I found a 2021 study in CrossFitters, and actually they found 1/3 of all of the injuries that the athletes were saying they had were hand and wrist injuries, and 70% of those were actually wrist injuries. Okay. So that's like, at least in this study, I don't know, around 15 to 20% of all injuries in CrossFit were at the hand and wrist. And I have to tell you, as an older CrossFit coach and as an athlete, the wrist gets aggravated pretty frequently in folks. I end up treating it quite a bit. And the thing is, there's not much research out there on how to best handle rehabilitation for these folks. So I just wanted to make a really good fitness pain-free show today to help you out with your patients and clients that are experiencing wrist pain, what to do and how to get it better, right? So where are these patients complaining of wrist pain? And typically it's going to be in the front rack. That's going to be the most common place where people have trouble, right? And this may be for front squats. It could be for clean and jerk, and also could be for thrusters, right? You see folks that are doing thrusters and maybe that first rep is feeling okay. And as they get a little further into their set, they notice they're having a harder time keeping that grip. The barbell is slipping into the fingertips, and all of a sudden towards the end of the set, their wrists are killing them. Their wrists feel super tight, right? This certainly happens. I also see it a lot in the snatch. So when you're receiving the barbell in that catch position, the wrists are supposed to be extended and also radial deviated. It's quite a bit of motion at the shoulder with a lot of load that can end up being pretty painful. The other super common place you'll see wrist pain is any sort of weight bearing on the hands. So that could be as easy as a simple push-up, but you also see it with handstand walking simply because when you're upside down, it's your full body weight on your hands. And if you pick up one hand, it's your full body weight now on one hand, right? Which can be quite a bit of stress on that wrist, right? You'll also see it doing crawl variations. If you do any sort of crawling in your fitness, this can be a common issue. And lastly, I see it during barbell lifts like the bench press. So in some folks, when they're trying to lift as much weight as they possibly can in the bench press, that tends to be quite a bit of weight on an extended wrist. And over the course of time, that can create some issues as well, right? So it's not just CrossFit. It's also powerlifting. It's also weight training in the gym. This wrist pain is fairly common in general. All right, so let's talk a little bit more about what is this pain in the back of the wrist, and really, I'm specifically talking about pain in the back of the wrist that hurts when the wrist is fully extended and you're putting weight on it or axial compression. Right? There are other types of wrist pain, more tendinous wrist pain, more ligamentous injuries. I'm not talking about that. I'm specifically talking about pain in the backside of the wrist that hurts during weight bearing. Okay. So that's going to be a combination of wrist extension, okay, and loading or axial compression. So think about doing a handstand. Your wrist is fully extended and your full body weight is going to be compressing the wrist joint in that position, okay? So first and foremost, if you start looking through the medical literature, it becomes pretty obvious that this is a pretty poorly understood condition. And there's a couple names for this type of pain that I found. So one you'll see is dorsal wrist pain. So basically pain on the back of the wrist, right? The other term that I read a few times is dorsal impaction syndrome. And this actually makes a lot of sense to me, right? So if you have repetitive axial loaded, axial loading of the wrist in dorsiflexion or wrist extension, right, it can end up with pain on the back of the wrist. So really what we're doing is that we're compressing the structures on the back of the wrist. So we're compressing the carpal bones together. We're compressing the carpal bones up against the radius or the ulna, right? Depending on how long your ulna is or what position your wrist is in, right? So this is a little bit difficult to understand, but if I'm doing a snatch, if I have a really wide grip, I'm extending my wrist, but I'm also radial deviating, right? If I'm doing a handstand or a jerk where I have a more narrow grip, I'm probably putting a little bit more stress on the ulna, right? Which may put some more compression on the lunate. Whereas if I have a wide grip and I'm snatching, it's probably going to be a little more stress on the scaphoid. And this may be an issue because in some folks, they end up with fractures of these bones, which is a problem we'll talk about in a minute, right? So I was able to find a cool study, and I put the link in the show notes, right, for all these references, where folks that had pain in the back of their wrist that hurt with weight bearing wrist extension, they took MRIs of these folks to see what the heck is going on. What kind of pathology are we dealing with, right? And actually found a decent amount of pathology in these folks. They found ganglion cysts, they found scapholunate ligament injuries or just degeneration, and they're also finding dorsal capsulitis, right? And some folks they actually found capsular abnormalities, which basically consisted of extra capsule that impinges or gets compressed in that wrist extended position, right? So think about it. If I have a little extra capsule on the backside of my wrist, and when I fully extend my wrist, it compresses those structures. And now I put my full body weight onto my wrist, right, in that extended position, I'm probably getting some good compression or impingement of those structures, right? So maybe that's a source of pain. Okay. So I think first and foremost, and this really goes for any type of pain problem in the gym, it's one of the major reasons why you really need to see a physical therapist or some sort of rehab professional if you're dealing with a pain problem or an injury. So you have to rule out red flags, right? What's a red flag? It means something is seriously wrong that needs medical attention. Okay. So what's important to be on the lookout for folks that have wrist pain? Well, the big one is going to be a fracture. Okay. And the two major bones that we're going to be concerned with are going to be the scaphoid as well as the lunate. All right. So with scaphoid fractures, they typically occur with what's called a fall on an outstretched hand, which is exactly what it sounds like. If you fall on an outstretched hand with the wrist extended, okay, there's a chance that you fracture your scaphoid, right? So here's the thing. If you're doing a lot of weight bearing, right? So handstand walking, snatching, bench pressing, whatever it is, that is going to be compression on the scaphoid, which may end up fracturing this bone over the course of time. Okay. And what I typically tell students I work with and my patients is that typically if you hear hoof beats behind you, you're going to think it's going to be horses behind you before you think zebras. Now, the zebra is going to be the scaphoid fracture, right? And really just probably have some irritation of the wrist joint, right? But we want to make sure we're not dealing with one of those zebras, one of those medical red flags. Okay. So typically, the best way to figure out whether or not you have a fracture is to get some sort of imaging. The trouble with imaging is if you take an x-ray, especially too early on, you might not pick up on the fracture, right? So the imaging becomes more sensitive if you wait 10 to 14 days or so after the initial injury. Okay. Some other diagnostic tests you can use are going to be whether or not there is tenderness or swelling in the snuff box, the anatomic snuff box. You can also try applying some axial pressure or compression on the thumb to see if that is going to reproduce some of the same pain that the patient's feeling. And the last thing is you can palpate for scaphoid tubercle tenderness. So what's kind of good about these tests is they have a high sensitivity. So what's kind of nice about that is you can rule out scaphoid fractures if these are going to be negative. If it is positive, it doesn't mean that you're going to have a fracture, right? So the specificity is actually not that good. Honestly, though, if I suspect someone has a scaphoid fracture, I am going to refer them right away. All right. And for the majority of folks who have wrist pain in the gym, they don't think about going to a doctor. It doesn't seem like a serious situation. However, I'll often tell them, like, look, I think I want you to get some imaging. I'm concerned you may have a fracture. The problem with fracturing these bones, and the lunate we'll talk about a bit later, is that they can end up dying. They don't have great blood supply. And if you fracture them, you can disrupt the blood supply to that area. You can get something called avascular necrosis, and then you can't really do much with that over the course of time, unfortunately. So we have to pick up on these early so we have a good chance of getting this fracture to heal. The other bone that we're concerned about is going to be the lunate, right? So if you look at the image here of the hand, so if you're watching this on the podcast format, I apologize, but this bone is going to sit on the ulnar side of the wrist, right? And it really sits right on the back of the wrist where most folks are saying, yeah, my pain is right here in this area. So the two bones that are taking the majority of stress are going to be the scaphoid bone as well as this lunate. Okay. The problem with these bones, right, in the lunate especially, is it has poor blood supply. And if you fracture this and the bone ends up dying, this is called Kienbach's disease, right? And it's actually kind of tough to manage this disease over the course of time. So it's important that we pick up on these early on so we have a better chance of getting this to heal. All right. How do we figure out if you have a lunate fracture? Well, imaging is a way to go. So if you have a patient that comes to you and they have pain right in the back of the wrist, especially have tenderness to palpation of that lunate, we should send them to the doctor, get some imaging, and see what the heck is going on. Okay. And the thing about Kienbach's disease, right? So avascular necrosis of the lunate is that this is not always a traumatic issue. So if you have a fall on an outstretched hand, can that fracture your scaphoid? Can that fracture your lunate? Of course, right? But repetitive micro trauma over the course of time. So think about a gymnast, right? Constantly putting weight on those hands, weight bearing on those wrists, that can cause a fracture over the course of time, right? So it could be a gradual onset as opposed to this all at once phenomenon. Okay. So yeah, recommend these patients go get some imaging sooner rather than later so we can rule out these more insidious problems that are going to cause long-term issues if we just tell folks to exercise through it. Okay. So what's the mechanism of injury for wrist pain in the gym? So the medical literature will say this is largely a condition of overload or overuse, right? And this makes a lot of sense to me. The folks that I see with wrist pain, they usually kind of learn that they start to love handstand work and they do lots and lots of handstands, or they're doing more Olympic weightlifting than they're used to, or they have a major mobility issue at the elbow or the shoulder, and their front rack looks absolutely terrible, and all the weight is going through the wrist and they're overloading the wrist simply because they don't have good mobility in the rest of the front rack, right? This makes sense, right? Yeah. So the medical literature says this is an overload condition, overuse condition of too much wrist extension and axial loading, right? So think again of someone doing a handstand, we're going to extend the wrist and we're going to load it with a full body weight, right? And the thing I like to bring up to people all the time is that the wrist was not designed for weight bearing in the same way that the ankle, the knees, the hips were designed for, right? So if you think about it, we've had years and years and years of evolution walking upright. Okay. So our wrists are not designed the same way as our hips, the knees, and the ankles are. Okay. It's also a much smaller joint. Okay. So when we do things in the gym like running, jumping, weight training for the lower body, those joints are probably better prepared to handle those force, right? The knees are more prepared to handle the force of squatting. If you think about the wrist joint, it probably wasn't designed for supporting hundreds of pounds overhead in a fully extended position or handling your full body weight, right? Upside down your hands and walking. Okay. So I think it's important that patients understand this because oftentimes they think like, okay, if my technique is good, then why does my wrist hurt when I'm doing a handstand? Well, it's probably because the wrist wasn't designed to do handstands in the first place. Okay. So the wrist is going to take more preparation in order to perform these things. And it's also probably not going to tolerate the same amount of volume of, let's say, squatting that the knee would be able to tolerate. Okay. Because the joint is made to handle those forces and the wrist just isn't. Okay. Now, this overuse can occur all at once. So if you have a tough workout that has a lot of hand balancing, handstand walking, a lot of upside down work in general, where you're weight bearing on the wrist, this can cause some irritation in the wrist joint, and that can kind of start that injury for a lot of folks. Okay. It can also happen over the course of time. So let's say someone has a problem with their front rack mobility and they start doing more jerk work, more clean work, more front squats. And gradually over the course of time, their wrists get aggravated just because we're taking a lot of stress through the wrist joint. The body's not recovering enough. Over the course of time, you can have some pain, right? That can certainly happen with a lot of folks. Now, if you want a really in-depth entire course, right, and presentation on how injuries occur in the gym, I have this. It's called the Fitness Pain Free Mini Course, and I'll put a link in the bio. So definitely check that out if you want some more in-depth injury mechanisms and also how to prevent these types of injuries in the in the future for your athletes. Definitely check it out. Link in the show notes, right? So, what is the physical therapy treatment for wrist pain for weightlifters? So, I've broken this down into 4 steps to make it nice and easy for you. Step number 1 is to unload the wrist to allow things to cool down a little bit. So, when you're really irritated and your wrist is killing you, right, it's good to back off of the movements that hurt you. The next thing we're going to do is strengthen the musculature around the wrist. And the muscles that are going to be most important are going to be the wrist flexors, right? So think about it this way. If we extend the wrist and weight bear on the wrist, the muscles that control that wrist extension are going to be the wrist flexors, right? So if they're weak and they're not able to control motion at the wrist, we can end up with pain and injury, right? And what we're trying to do is build tolerance or capacity of the wrist to handle wrist extension and axial compression. And the musculature that's going to allow us to do that are going to be the wrist flexors and also the finger flexors. So we do a lot of work to strengthen those. Okay. And we spend a lot of time getting good at handling wrist extension and axial compression, right? Step number 3, we want to mobilize the surrounding joints and restore wrist extension, range of motion, and ability to tolerate end range extension. Okay. We want to mobilize the elbows, the shoulders, and the T spine. More on this later. We also need to mobilize the hips, knees, and ankles if we're doing things like front squats and overhead squats and snatches, right? The reason being is that if I'm stiff in my ankle or my hip, that's going to cause some problems upstream, right? My elbows are going to drop in my front rack, and all of a sudden I've got more stress on my wrist. Okay, so we got to think about the entire chain. And lastly, we want to progressive return back to offending movements once you strengthen the wrist and allowed some of that pain to die down over the course of time, right? That may mean that you have to modify your technique during some of your lifts. So let's say being a little more upright in your front squat might take off some of the stress on that wrist, just to modify stress as needed, right? It also may mean modifying your handstand technique, improving your line, right? So you don't have as much stress on that wrist. Maybe you need to modify your bench press by changing your grip width. Maybe the wide grip is causing a little bit of extra stress on that scaphoid area, and we're trying to back off of that over the course of time. So we'll talk about that a bit later. But it may be something that's important to modify for long-term success so you don't keep on re-exacerbating prior injuries. So what are the most offensive movements in the gym? What are the movements in the gym that typically can create this type of pain or perpetuate this type of pain in the gym? Typically, this is going to be the front rack position. So cleans, front squats, jerks, and thrusters tend to be movements that can really aggravate the wrist joint, right? The other group of movements that hurt are going to be weight bearing, right, on an extended wrist position. So this is going to be your handstands, especially handstand walking, push-ups, crawls, bench press, as well as snatch, right? Because all those movements we're going to be extending the wrist and applying an axial load. So early on in rehab, we have to make sure we have good modifications for these movements so we don't keep on irritating that wrist joint over the course of time, right? If we don't modify these movements, it's kind of the same as having a rock in your shoe, pushing on your foot and giving you pain every time you take a step, and then taking a whole bunch of ibuprofen to get rid of the pain, but you never take the rock out, right? We have to temporarily take out these movements to keep on aggravating the wrist. So over the course of time, we can allow the area to recover. Okay. So, how do we unload and modify these movements? Well, for the bench press, we can do a variety of different things. One of the first things I like to try with my patients is just to utilize a thicker grip as opposed to a regular barbell. And this is going to allow the wrist to be in a more neutral position. So, we're taking away some of that end range extension. And oftentimes that allows people to train without pain or very minimal very minimal pain, which is going to be great because our goal at the end of the day is to allow our patients and clients to continue exercising and working towards their goals, right? There's a myriad of benefits to continue exercising. We want to respect that healing injury site. Okay. We can also switch over to dumbbells. So if barbell bench press is killing, dumbbell bench press might feel phenomenal because we can keep a more neutral wrist position. And lastly, I'm okay with people using wrist wraps temporarily to help to unload the area, all right, but allow us to continue training. Okay, so you can try some of these modifications and utilize the one that allows you to train with less pain. How about the snatch? Well, for the snatch, this is a little bit more challenging to unload. You can try using a wrist wrap and really aggressively wrap that wrist up, and that's going to limit as much extension and radial deviation, which can be helpful. For a lot of my folks that are very, very painful, some of the patients that are very, very painful, the wraps are simply not enough help, and I'll just modify them to doing different variations. So dumbbell snatch variations. Okay, maybe I'll do more snatch pulls. So we're not actually catching that weight fully locked overhead, but we're still working on the triple extension and the lower body power you need to help with your Olympic lifts. But we just can't tolerate weight bearing in that position, right? How about cleans, front squats, and jerks? Well, same thing. We can pretty easily use a wrist wrap to try to reduce some of that extension and compression on the wrist, which is sometimes helpful. If that doesn't work, we can switch over to, let's say, dumbbells, right? But, there's a point of diminishing returns with a dumbbell clean, right? You can't go super heavy on dumbbell clean. So sometimes we just get rid of the clean for a little bit. We get rid of the snatch for a little bit with a plan on reintroducing them as soon as the wrist can tolerate a little bit more stress, right? How about handstands and pushups? Well, one of the easy things you can try, and these are temporary modifications, right? So for the handstand, eventually we want to get back to the point where you can tolerate fingers straight ahead, right? But when you do a handstand with your fingers straight ahead, that's going to be the maximum amount of extension on the wrist. If we finger out a little bit, it's going to reduce the amount of wrist extension you need to do a handstand. You can also take your grip a little bit wider, which does the same thing. So it reduces some of the wrist extension. Okay. It's very similar to a squat. So if you have someone who has limited ankle dorsiflexion range of motion, they may end up taking a little bit wider stance with a little more toe out because they don't have the range of motion to get deep in a squat and they don't have the ability to dorsiflex, right? So if you limit the amount of finger ahead and get a little bit wider with your grip when you're doing a handstand, that's also going to reduce the amount of wrist extension. And it can be a nice modification for folks that are really painful. Okay. What else can we try? So some really easy modifications for folks with wrist pain during handstands or handstand push-ups, as well as regular push-ups, is just use a parallel, right? So just utilize dumbbells or parallettes so someone can use a grip around that bar and keep the wrist in neutral position. Super easy fix and, very, very fast. Another thing you can try is to raise the heel of the hand a little bit. So if I'm doing a push-up, if I have a small elevation under the heel of my hand, it puts my wrist into more wrist flexion. It reduces that amount of extension and it tends to feel pretty good as well. So another easy modification you could try. Next step, we need to strengthen the area, right? So we want to strengthen the musculature that resists wrist extension, and that's going to be the wrist flexors, right? So when I think about the wrist flexors, an analogy that tends to make sense with folks is that the wrist flexors are kind of like core strength for low back pain, right? So if I'm trying to do a push up and I have a weak core, I might extend my lower back too much, right? And the same thing goes for an overhead press. If I have reduced strength in my core and I try to press something overhead, I may extend back excessively. Okay. And the idea is that if you don't have enough wrist flexor strength or enough core strength, that's going to extend the wrist more, right? Or extend the spine more. So when we strengthen the wrist flexors, it allows us to control the position of your spine better. Okay. So that's why I put so much emphasis on the wrist flexors, right? And here's a thought that I think this makes a ton of sense. I tell my patients this, and I think it makes a ton of sense from a rehab perspective. So if your body doesn't trust you going into wrist extension and applying a bunch of compression to that area, okay, we want to reestablish trust with the body. So that means temporarily staying away from things that aggravate it, but it's also strengthening all the muscles that build stability to that area. So over the course of time, you're building back trust with your body, so you're able to get back into these positions without your body giving you a whole bunch of pain, right? Hopefully that makes sense. Okay. We also want to build stability in all the musculature that crosses the wrist. So generally speaking, we want a well-rounded program for the rest of the wrist and the hand. And then we need to spend more time in wrist extension and axial loading. So after we spend some time away from extending and compressing the wrist joint, we need to spend some more time in these positions to build some strength, right? We need to do some weight training. We need to try to strengthen this area. And it's kind of like an analogy to running. So if you need to strengthen the foot and ankle, you probably need to spend some time running if you want to become a runner. Okay. If you want to get better at hand balancing, right? Handstand walking, snatching, we need to do some hand balancing, right? We need to spend some time on our hands to build some strength and stability in those positions, just like a runner needs to spend some time on their feet, right? Makes total sense. What are the best physical therapy exercises for wrist pain in weightlifters? If you don't want to hear me talk about the rationale of all of these exercises and you want to see specific exercise videos of all these exercises, click on the show notes. I have an entire article that goes through these. But in case you want to hear the rationale, then listen on. So I want to go through my favorite movements from easy to moderate to advanced, just because every person that you work with is going to be at a different level in terms of how irritable the wrist is, but also their training age and background, right? So if you have someone who does hand balancing professionally, right, they're going to need a different program than someone who's 50 years old and trying CrossFit for the first time. And they're not used to working out at all. Okay. So you just need to keep in mind that we're going to meet the individual based on their training age and how irritable they are. Okay. So what are some of the easier exercises that you can begin with someone that's going to be either A, very irritable, or they're just a novice in terms of weight training? So I like to do something called a wrist up. I learned this from Dave Durante. So if you're watching this on YouTube, there's a picture of Dave Durante doing this wrist up here. But to describe it, you start on your hands and knees. That's the easiest variation. We'll go over some harder variations over the course of time. And it's kind of like doing a calf raise, but for the forearm muscles, right? So you start with the hand flat on the ground, and then you push up. You push the heel of the hand or the palm of the hand up while leaving your fingers flat on the ground, right? So think about doing a calf raise where your toes stay flat on the ground, but your heel comes off the ground. This is the same thing as a wrist up, just like a calf raise where the fingers stay on the ground and the heel of the hand pops off the ground. Okay. And you just perform repetitions just like you're doing a calf raise. All right. The next exercise I love is going to be the wrist curl for wrist pain. Okay. So trying to be able to tolerate wrist extension and strengthening the wrist flexors is super important for wrist pain. So what's the best way to directly train that? It's going to be a wrist curl. Okay. I love performing these both with a full grip on the bar. And I also like performing these where the bar goes into the fingertips. I think this is phenomenal because a lot of folks with wrist pain don't tolerate the front rack position. And if we allow the dumbbell to rest into the fingertips fully when we're doing wrist curls, it's going to build some strength and tolerance in the fingers as well as the wrist. So over the course of time, that front rack is better tolerated. Okay. And the last exercise that I love for wrist pain, one of the easier variations, but we can definitely give you some harder variations of this over the course of time. We'll talk about it, are going to be wrist rocks. Okay. And these can be performed on a parallel or with your hand flat on the floor. So to describe this, you start on your hands and knees with the hand flat on the floor. Okay. And then we rock our body weight over our fingertips with the elbow straight and then back further towards your feet, back and forth. And we're trying to control this motion with your fingertips and your wrist, right? So basically, we're building strength and control of the wrist musculature, and we're trying to drive motion of our body through our wrists and our fingertips, okay? And I'll show you over the course of time, but we can very easily make this more challenging. But the reason why I like these wrist rocks so much is because if you get really good at this, it's going to help you a ton with hand balancing. Because when you balance on your hands, you're using your fingertips and your wrist to control motion, just like when you're standing on your feet, you're using your foot and ankle in order to balance yourself, right? So once you're out of that highly irritable phase, or you're just dealing with someone that's at a higher level, you can start working towards more moderate, challenging exercises for the wrist. So, how do we start to advance the exercises, right? So, first and foremost, we can use that wrist up exercise that I talked about prior in the easy exercises. And we can go into a plank position, all right, and try to perform these with more body weight on your hands. Now, what I will say is that these are actually very, very hard if you've never tried those before. And I consider myself a decent hand balancer, right? I'm not bad at handstands, and I can't do these, right? So these are actually advanced for me. I usually perform these on a bench, right? I also like to start performing more weight bearing on the hand. So we need to start building a little bit of tolerance in a wrist extended position with load after you have a wrist injury. Obviously, that's what we want to get back to. And a great way to start putting some weight on there and building some tolerance is by doing crawl variations. Okay. So if we're eventually going to get to handstands, which is full body weight on your hands, right? Doing a crawl variation is partial body weight on your hand, right? Which is nice and it's good stepping stone to get back to handstand walking over the course of time. So I like performing crawl variations forward and backwards. So on your hands and knees in a plank position or with your knees bent and crawling backwards and forwards. I also like lateral inchworms and regular inchworms. So basically starting in a push-up position and walking your toes up to your hands and then walking your hands back out again. All right. Or get into a plank position and walking your hands out until you're as far spread out as you can from your hands to your feet and just walking sideways. Okay. Another easy exercise I like to prescribe a lot with my patients is called a plank shoulder tap. So you're just in a push up position, right? And you tap one shoulder, then tap the other shoulder. So starting to build a little strength and tolerance in the wrist. Some other intermediate exercises are starting to get a little bit tougher are going to be handstand holds, right? I really like stomach to wall handstand holds because it puts your body in a nice straight line. And that's what we really want for a handstand. You can also start doing what are called floaters. So if I am in a handstand position off the wall, I try to utilize my finger and wrist muscles to pry my feet off the wall, float my feet off the wall, and then allow my feet to slide right back to the wall. So I'm utilizing my hands and wrists to peel my feet off the wall, and then my feet are going to fall right back to the wall. So I do these floats back and forth, feet off, feet on, feet off, feet on. We can do these facing the wall. We can also do these with your back towards the wall. Okay. I also like to start to advance my wrist curl exercises by starting to perform these on my back with my hand up towards the ceiling. So imagine me just locking out a dumbbell bench press on one arm, and then I perform a wrist extension, right, with my arm fully locked out in this position. The reason why I like this as an advancement to a regular wrist curl is because I'm starting to apply a little bit of wrist extension and compression, right? So I'm starting to get my stress to the wrist more specific to the task I want to get back to, which is handstand walking. So I'm still strengthening my wrist flexors, but I'm doing it in a more specific position. Okay. I like to do this with a dumbbell either in a full grip, right? Or allowing the dumbbell to go into my fingertips. So getting a nice stretch through the fingers, right? Fingers back. What's nice about this, again, is that it's going to help prepare me for the front rack position where I need not only wrist extension, but I also have to stretch my fingers back a little bit. Okay. We can also start to advance our wrist rocks that I described earlier. So we can start performing the wrist rocks in a piked position. So now I have more and more body weight onto my hands. It just gets a little bit tougher for the wrist muscles and it starts to apply a little bit more axial compression to the joint, right? But we want that because over the course of time, we're going from easier exercises to harder exercises. Next, we have more advanced exercises, right? And here's the thing the majority of your patients may never get to this point. But if you have someone that really wants to get good at handstands, handstand walking, hand balancing, then you're definitely going to want to utilize some of these advanced exercises over the course of time. Okay. If you're working with, let's say, circ athletes or just very, very high level hand balancers in general, then you definitely want to make sure you're using some of these. Okay. They're awesome because they're also going to transfer over to the skills that we want to get better at. Okay. So I'm often prescribing these to folks from a performance perspective as well as a rehab perspective. Okay. So one of the first exercises I really like that are advanced for wrist pain are going to be wall walks. So basically starting in a push-up position with your feet at a wall and then starting to walk your feet up to the wall until your nose is touching the wall and you're in a full handstand and you're facing the wall at the same time. Okay. Another exercise I really like is a lateral wall walk. So basically, when you're in a full handstand with your feet against the wall, you start taking steps to the side, right? And these can be performed with your face towards the wall or your face away from the wall. I really prefer wall facing wall walks because we are optimizing our line for the handstand simply because if we have our face away from the wall, it's going to extend our spines more. So our line is not quite as good as when you're doing a wall facing lateral wall walk. Okay. Some other advanced exercises for the wrist that I like are going to be overhead squats, simply because we have the wrist in an extended position with a load. So we're building some strength and tolerance in that position, doing multiple reps. What's also cool is that the majority of our athletes are trying to get back to snatching with wrist pain. And this is a very specific exercise for them. Okay. I also like snatch balances for the same reason. These are a little bit more dynamic, so you have to be a little more cautious with the application of these. But if you have an athlete that's tolerating overhead squats well, and they want an advancement, I think that snatch balance is going to be great. The last exercise that can be really, really good for folks, especially folks that are trying to get back to hand balancing and hand walking, is going to be weight shifting in a handstand, right? So let's say I kick up to a handstand with my feet against the wall. I can shift my weight to my left arm, to my right arm, back and forth, and I can even pause on one arm and do some pauses for the more advanced athlete. Just keep in mind, this is probably one of the hardest movements that you can give someone for the wrist, right? So this is going to be at the very, very end stage of rehab for more advanced athletes. Okay. So let's go over some exercise prescription and dosing for wrist pain. Okay. So let's go over some principles because every single patient is going to be a little bit different, right? So I want to give you some principles that are going to extend to a continuum of patients. So patients that are very irritable, very high level, very low level. If you understand these principles, you can apply some of this easily to a broad spectrum of people, right? So the first thing to keep in mind is that you want to try to meet patients where they are. Okay. And I already alluded to this, but it depends on how irritable a patient is, right? And how advanced they are in terms of training age and background. So if someone is super irritable, I'm going to start really easy with the rehab exercises. If they're not that irritable, then I'm going to give them harder exercises. Okay. If someone is an Olympic gymnast, I'm going to give them a more advanced exercise, but also try to respect how irritable they are. Okay. So if I have a super high level individual that's coming to me, plus they're not that, irritable, then I'm going to give them really, really hard movements. Right. But if I have a really high level individual that's super irritable, I might have to really back off. Okay. Let's say if I have someone who's moderately irritable, but has never really done much weight training, then I have to be really careful about what movements I give them. I might have to give them really easy exercises, right? They're not that irritable, but they're actually not very strong either. So you have to keep that in mind when you're applying your exercises. Okay. Basic principle here, we start with easy movements and we progress to more advanced movements. And I tend to advance my patients every 2 to 4 weeks or so as they get stronger over the course of time. One thing I tell my patients all the time is that physical therapy is kind of like making soup. When you're making soup, you add a little salt, then you taste it. If it needs a little bit more salt, you add a little bit more, and you keep on doing this until it's perfect. If you start off by adding a full fistful of of salt into your soup, you may ruin the soup. Okay. Same thing goes with physical therapy. We start with easy exercises. We see how you feel. And if you're doing well, it's pretty easy to just ramp up. Okay. If you do too much exercise in the beginning, you may really flare up your patient. They might be mad at you and never come back. All right. So let's make sure that we avoid that as best we can. How about exercise dosage? So typically speaking, I'm writing programs for my athletes and I'm giving them exercises 3 times a week, right? That's usually somewhere between 2 to 4 sets of 6 to 10 repetitions. And again, it really depends on the movement that I'm giving my athlete. Okay. I usually do 2 to 3 exercises per session. Okay. And after you've written a really good program for your athletes, after you've unloaded things and they're starting to feel better, we're going to have to return back to those previously offensive movements. Okay. So, like the clean, snatches, and handstands, we just want to make sure we do it slowly over the course of time. Okay. So here's a sample physical therapy program for someone with wrist pain that wants to get back to weightlifting. Okay. So let's say it's a 34-year-old male, and they've been doing CrossFit for around 3 years. They're actually pretty good at gymnastics. They're very competent with handstands. They really enjoy the gymnastics element of CrossFit. Okay. Let's also say they've been weight training since they've been a teenager, right? So we're looking at almost 2 decades of weight training experience. All right. So the thing is, I'm pretty confident they can tolerate some higher level gymnastics stuff if I prescribe it to them. I'm not super concerned that we have to start at a super low level because they're very low in training age. This person has been doing CrossFit for a couple years. They're decent at gymnastics. Plus, they've been weight training for 20 years in general. Okay. Let's say that they're moderately irritated. So they're not super duper painful. Okay. But it is hurting them quite a bit. What does a program look like? So, like I said previously, I'm going to do 3 days worth of strength training per week, right? Let's say day one has 3 exercises. The first exercise is a wrist curl, 3 sets of 10 to 12. The second exercise is a wrist rock, starting on the hands and knees because of how irritable he is, 3 sets of 8 to 10. And the third exercise is going to be an inchworm, 3 sets of 4 to 6, to help to build some tolerance in that wrist extended axial compressive position. All right. Day two, we have supine wrist curl. So basically on your back, and you have your arm extended like you just finished a bench press. And we're allowing that wrist to do a curl. All right. Sets and reps, 3 sets of 10 to 12 repetitions. Second exercise, the wrist rocks again. I really love these. Oftentimes I am prescribing them multiple times per week. The third exercise is going to be a lateral inchworm. So starting a plank position, walk those hands out a little bit and walking side to side. Again, we're trying to build some tolerance in that wrist extended position. Day three, we're doing wrist curls again. This time we go into the fingertips, 3 sets of 10 to 12. Follow these up with wrist rocks on the hands and knees again. And the third exercise is going to be a handstand hold versus the wall, 3 sets of 30 seconds, right? So here's a sample program. And over the course of time, obviously, we want to make this harder and get people back to their activities. What's the next step with wrist physical therapy? Well, we're looking to restore wrist mobility. And I think this is a really important thing to understand, right? Oftentimes, the wrist ends up hurting in folks in the gym, not because the wrist needs more mobility, but because other structures lack the mobility and aren't doing their job. Okay. This often happens in the front rack. So if I'm doing a thruster, if I'm doing a clean, or if I'm doing a jerk, and I don't have good mobility at the wrist, or I don't have good mobility at the shoulder, I may end up having my wrist a little lower in my front rack. And then I am fully extending my wrist. I am really bending my fingers back, and that can cause quite a bit of pain. All right. So in that individual, we have to make sure, A, do they have wrist mobility issues? Because it sounds like the wrist is doing too much, right? Okay. And if that's the case, yeah, we probably need to mobilize the wrist and get it back to where, get it to where it needs to be. But the other piece is that we need to mobilize all the tissues and joints around the wrist, right? So the elbow, the shoulder, thoracic spine, and also what's downstream. So the ankles and the hips. Okay. So an easy assessment to see if the wrist is going to be needing mobility is a prayer test. So you stand with your hands together in a prayer position, heels of the hand are touching, and then try to extend the wrist as much as possible. And what we're looking for is that, does the crease of the wrist, or where the wrist bend, does that go below the tip or the point of the elbow? If it does, that's a pass, and you don't need more wrist mobility. Okay. Also, keep in mind, this may be limited in folks that are really irritable in the wrist just because the wrist joint is so painful at this point. Okay. You might not need to be aggressive about mobilizing. As that pain goes down over the course of time, you may find that that range of motion naturally comes back. Okay. So, first and foremost, again, just reiterate, got to make sure that you need wrist mobility before you start mobilizing it. And the other piece is that if you're too aggressive about wrist mobility early on in rehab, especially with an irritable wrist, you may flare it up more, right? So just keep in mind, you might need to take some time away from mobilizing the wrist initially, with the goal over the course of time is we need to restore this as that irritability goes down, right? So when someone is highly irritable, one of the best ways I like to mobilize the wrist joint is by utilizing soft tissue work. So if we use a barbell or we use a ball on the forearm musculature, the forearm flexors, to restore wrist extension, this is usually pretty nice because we're not wailing on wrist extension by stretching the wrist back into more wrist extension. Remember, that could be what hurt the wrist in the first place. So early on, we don't want to repeat that mistake and keep on wailing on the wrist. Let's utilize some soft tissue work to restore that range of motion. Okay. As the joint starts to tolerate more extension, we can progress towards stretching and eccentrics over the course of time, which is a phenomenal way to gain wrist extension range of motion. The next step is to mobilize the surrounding structures. So, what do I mean by that? So, if I catch a clean, if I'm in the bottom of my front squat, okay, in a front rack position, I need to have range of motion at my wrist, my elbows, my thoracic spine, the shoulder joint, the hips, the knees, as well as the ankles. If I am stiff in any of these areas, it may mean the wrist has to do more work and move more to make up for the lack of range of motion elsewhere. Okay. So we want to make sure we assess these and ensure that we have adequate range of motion there. Okay. So here's the thing. I have a super in-depth article on how to do this, Ultimate Guide to Front Rack Mobility, right? I'll put that link in the show notes, but I'll show you how to access all of these joints, and I'll show you some mobilizations for all the joints as well, okay? The other movements, I guess, plural, that we need to be aware of that can aggravate the wrist if we don't have great range of motion through the joints above and below is going to be the handstand as well as overhead exercises like a jerk, right? Or snatch. So if I am lacking range of motion at my shoulder or my thoracic spine, then when I go into a handstand, I will probably have to arch more at my lower back, or I have to overextend at the wrist in order to stack my body over top of my hand. Okay. So if I get better range of motion in my shoulder, it actually reduces the amount of flexibility I need at my wrist. Okay. So again, I have a lot of good guides on my website to help you assess this and improve it over the course of time. I'll put a link on how to improve your overhead mobility and how to assess your overhead mobility, link in the show notes. So definitely check that out. Okay. The last thing we need to do is have a progressive return back to training. Okay. And again, I'm going to talk about some overarching principles, okay? Because you're going to be confronted with a variety of different people, a variety of different training backgrounds, a variety of different levels of pain, okay? So I'm going to give you some principles you can apply to all of your individuals, but just keep in mind it's going to change based on the individual by quite a bit, all right? We've got to roll with the punches, got to critically think, critically reason to be a good physical therapist. So keep this in mind, all right? So when I start to return individuals back to, let's say, handstand push-ups or snatches or regular push-ups, I usually just incorporate one new movement at a time. Okay. So maybe we start incorporating more weight bearing on the wrist with the snatch. And that's the first movement that we put into an athlete's program, but we only incorporate the snatch, right? And let's say we do the snatch for 1 week and things are going really well. The following week, maybe we put in handstands back into the program. Okay. So I'm just making up these movements, but this is generally how I end up going about it. We incorporate one new movement, we see how things are going for about a week, and then we incorporate another movement. We just keep doing this until the athlete's back to all the movements that they want to get back to, right? Generally speaking, when we incorporate new movements, we start with slower movement speeds and lighter loads, and we progress to heavy movements with faster speeds. Okay. So going back to the overhead squat or the snatch as the example, if we want to get back to snatching, maybe we introduce overhead squatting, but we do it in a nice slow way with a lighter load. And over the course of time, we progress our way back to heavier snatching, starting with higher reps and then maybe going to lower reps, right? So we progressively increase that load over the course of time. Okay. Generally speaking, from a rehab perspective, we start with lower volume and then we work our way to higher volume, right? So maybe we start by snatching 1 day per week. And as I build more tolerance in the wrist, now I'm doing twice a week. And eventually, if I want to get back to 3 times a week, I start doing that. Okay. Again, it really depends on the individual. Some folks aren't going to get back to 3 days per week worth of snatching because that's not what they want to do or what's best for them. All right. So just keep that in mind. All right. And last piece is that as much as I love physical therapy, we shouldn't have to do physical therapy for the rest of our lives. If we have a really good training program, it should meet us where we are in terms of where we want to be from a fitness perspective and also how much these joints are able to tolerate. All right. So as we start to increase the amount of regular training, I start to decrease the amount of physical therapy simultaneously. Okay. So if we were doing 3 times per week worth of strengthening for the wrist, I may go down to 1 time per week as we start doing more training. Okay. And again, we're trying to match the volume that we're doing in physical therapy to the volume that we want to be able to do with training. So as we start to leak in more training, we start to leak out some of that physical therapy, and we're trying to match the volume that we want to be able to do with our training with our physical therapy, and just slowly decrease the physical therapy, slowly increase the training over the course of time. So we don't have any big spikes in training volume or intensity as we progress. It should be nice and slow progression back to training over the course of time. And lastly, here are my references. They're going to be in the show notes. So definitely check those out if you'd like to. All right. I always try to keep my references there. If you have any comments about the references I use, I'd love to hear them in the comment section below. And lastly, thank you so much for your support. You truly do allow me to do what I love for a living. I greatly appreciate you watching this. All right. If you're watching this on YouTube, please give me a thumbs up, leave a comment. What do you think of these exercises? What do you think about this rehabilitation? Was this helpful? Let me know below. Would love to hear your thoughts. And lastly, if you're not already, please subscribe to the channel. Helps me out greatly. If you're listening to this via podcast, please leave me a positive rating and review. Helps out with the algorithm, allows me to grow and continue doing these over the course of time. And lastly, if you want to support me that extra step, the extra bit more, head over to fitnesspainfree.com, click on the programs link, click on Fitness Pain Free Insiders Online Library, subscribe. It's just $1 to start, $12.99 per month after that. You get more great learning. Thank you guys again, and I'll see you on the next one.